Our first segment is brought to you by Engineered Tax Services, where engineering and accounting come together. Joining us via Skype is Karyn Turk, host of Red America Radio. Welcome back, Karyn.
Hi, great to be back.
We're so happy to have you, Karyn. And the American Heart Association and the American Academy of Pediatrics have come out in favor of a tax on sugary drinks as a method of reducing sugar intake for young children. What do you think about this? Do states have a right to use taxes to curb our behavior?
You can look at this a variety of different ways, and I've read a lot of articles on this, and I actually think this is a great idea. If you look at, a few decades ago and what happened with the cigarette tax and how that's impacted the health of America, you're looking at something that really could curb childhood obesity, could allow implementing of social programs that could help people lose weight. We have a record amount of people with diabetes. We can create an environment that's a lot healthier by implementing this tax.
So, Karyn, I know a lot of conservatives, they don't like taxes, so no matter what the substance is, they don't want to see a high tax. What's your response to that? It sounds like you're supporting the tax.
I actually am. And, surprisingly, Mayor Bloomberg and I don't agree on much, but this was a program that he actually had discussed. And when I saw it roll out, I thought, you know what, this is something that I can sort of get behind. I mean, there's a lot of moving parts with this. There's a lot of things that we have to look at. But when you talk about something that's become a health epidemic, you talk about something that is affecting American lives every single day at record numbers, and obesity leads to so many other problems, not just diabetes, tons of health problems. And you look at the cigarette tax and what that did to curb a lot of that and allow, these programs to come out and help people with smoking cessation. Now you're talking about being able to reduce the number of children who are going to have lifelong health problems that result in illnesses that can create death. I can stand behind that. I think it could create a lot of revenue. And most of all, what would be great about this is it would allow people to be healthier.
I'm curious around, I agree with you. I do think it's important that we highlight it because the marketing is so great around sugary drinks. It makes you feel like it's sunshine when really it is unhealthy. But is there a slippery slope here where will there be taxes on everything that's unhealthy, right? Do I have to now pay a tax on French fries or anything else? So what is the line if we start to really let the government dictate what is healthy and what we can purchase?
And that's the moving parts with this. And although, in theory, I stand behind it, like I said, it's something that, is going to require a lot of analysis. And I think that some of the states that are looking to put this, model to work, we're going to see the results and how that impacts their health as a state or a city. And we're going to have to look at those things and see if the program actually works. But if you look at other countries, in particular the UK and some other countries in, European nations, they've gone ahead and they have implemented these programs and they have been successful in impacting the health of their societies. So, there's part of it that you say you don't want big government, you don't want the government dictating, what I can or can't put in my body. But at the same time, we're talking about children's obesity. That's something for America right now that has a huge impact, and this could save lives.
Karyn, but what about the response where people say, no, this should really be about parents, that parents, they should be stepping in. They're the ones who should have ultimate responsibility. And if we're ceding control to the government or expecting the government to be the nanny state, isn't that just encouraging negligent parenthood?
Well, I'm all about personal responsibility, and I am a conservative, and I would hope that, a lot of people would be able to take personal responsibility. But when you see that people aren't changing and their kids are being affected and lives are being lost, then you have to look at, are people going to do it? I mean, these are addictive substances. Food and sugar are addictive substances. And if people can't curb the addiction, maybe they need some help doing that. And these programs could be rolled out from the tax money.
We got a viewer comment. Marlene Robertson says, we have this in Scotland. It works great. I want to ask you though, Karyn, because you mentioned it's an addictive substance, and when you said this, it brought to my mind the ban we have on addictive drugs. Yet what we've seen is that there's now an underground market. Same thing with cigarettes. There are incredibly high taxes on cigarettes, but there's a burgeoning underground market for illegal cigarettes that are cheaper, and that was part of what drove the death of Eric Garner, was because he was selling cigarettes at a cheaper cost. Would we see the burgeoning of maybe unsafe products because of these taxes?
I mean, the products are already unsafe. That's the reality. The products are unsafe. They are not helping us be healthier as a society. People are not able to stay away and not buy that 32-ounce soda. So, I'm not a big proponent of a lot of social programs, and I'm not a big proponent of higher taxes. But I also see this and I say, we have such a huge problem with obesity, and it's working for other countries and it's working for cities that have implemented similar programs. And maybe this is a way to help people be healthier. I mean, that's the bottom line.
All right, Karyn Turk, thank you for your perspective. We appreciate it.
Thanks so much.